On today's show, a CARP special, vaccines and you. 4 years ago, vaccines were top of mind for everybody. But with many wishing to put COVID-19 in the rearview mirror, have we let our vaccine regimen slip by the wayside? To find out, CARP recently conducted a survey on vaccines in Canada. It turns out that 95% of CARP members have received at least one COVID-19 vaccine. But only 65% of them have received all the boosters that they're eligible for. So why are we letting our vaccine regimen slip? To help answer that and address CARP members' burning questions about vaccines, I'm going to turn the floor over to Anthony Quinn, Chief Operating Officer of CARP. Anthony will be speaking with immunization educator Dr. Palmay in Toronto. Over to you, Anthony.
Thanks, Carmen. I'm here in Toronto with Dr. Christine Palmay. She's a family physician with a very busy medical practice here in Toronto, and she spends a lot of her time writing about immunization and public health education. So welcome, Dr. Christine.
Delighted to be here.
Can you tell me a bit about your interest in public health and immunizations?
Yeah, I think by virtue of being a primary care physician, I spent a lot of time educating patients. But, we are in the renaissance of medicine. Therapeutics, our understanding of disease states change on an hourly basis. It's hard for myself to keep up to date. And certainly public interest in medical care wellness has exploded. And I really think it's important to provide credible, updated information to a public, in order to guide good decisions, not only personal decisions, but at a public level, and be an advocate for that.
You also write often about immunization and public health education issues.
Yeah.
So we're here to learn from you today. Can you tell us a bit about what's going on with respiratory viruses in Canada?
Well, I think we have come to accept, reluctantly, that the long Canadian winter is synonymous with cough and flu season, right? At the end of summer, I think family medicine, primary care in general, start worrying, about the months ahead. And typically when you think about seasonalities with viruses, certainly at this time, influenza is top of mind, RSV is top of mind, pneumococcal disease is top of mind, and somewhat new to the family of viruses that seem to stay for Christmas or Hanukkah dinner is COVID-19. Now, just to be clear, COVID is not seasonal. We see, upstrokes of infection in the spring. So, we had a spring updated vaccine. The problem and the challenge is during respiratory season, when you have every other virus that is rearing its ugly head and saying, hello, we're back, we still have to include COVID. It's also a time that Canadians are nestled into our warm houses because it's freezing out. We're celebrating. Every single holiday happens, and that just lays the ground. It's a perfect storm for propagating these viruses.
So we're gathering together indoors more often, and these viruses are
Correct.
Spreading around. What is our best first line of defense against these viruses that we can be exposed to?
Well, that's a really nice segue. I think emerging from COVID, I start having discussions with patients that, during COVID, we only had the opportunity to be reactive. We were rushing to vaccinate ourselves out of a pandemic, which was exhausting. It wasn't particularly effective. And now with a bit more knowledge and we have routines in place, we can be proactive. And the most significant thing we can do in terms of preventative medicine is vaccination. That's one of the pillars of preventative care.
So we've polled our members at CARP, and 95% of them have said they've had at least one COVID vaccine,
well done.
probably
well done.
in the early throes of the pandemic. But what should they do now?
Yeah, so when people come into me when I start talking about COVID vaccines, they wave their hands, they said, I have 21 vaccines, I've had 3 vaccines, I'm done. So there's a couple of points. Number one, we're not counting vaccines. Science evolves, medicine evolves based on data. And there are variants that change. So to have two vaccines that are old and don't match the variants in that particular time period, it's not helpful. There's also an expiration date to the protective nature of vaccines. Generally, the rule of thumb is about 6 months. So you have to update your vaccine status. And it doesn't matter if you've had 10, it doesn't matter if you've had 5. Point being, you want the most updated vaccine that reflects what's happening in the community. So now the guidance would be, in general, and there's always exceptions, your COVID updated vaccine should be given 6 months after your previous vaccine, it doesn't matter what number, and or a COVID infection. Unlike other types of infections, you do not develop long-term immunity to COVID, and you do need and will continue to need an updated COVID vaccine.
So I know that as we are children, we get a vaccine that we may only get once in our lives.
Correct.
Why do we have to get something like a COVID vaccine more than once?
Yeah, so a lot of that is because shifting viruses, right? Viruses are smart. Their sole purpose is to propagate themselves. So they mutate and change to evade our immune systems. I often use the metaphor of updating your viral software in your computer, right? You update your malware because smart people are making viruses to infiltrate our computers and steal data. Respiratory viruses and any virus is no different. So updating your immune status by taking the most updated vaccine that's possible is the best form of prevention. What it does, it injects basically a script. It's almost like a recipe for our cells to make the spike protein that's on COVID.
Welcome back. Today, we're turning the floor over to our friends at CARP to answer your questions about vaccines. According to a recent survey of CARP members, 70% believe that vaccines are important, not just for their own health, but for others. But how do vaccines protect us and our loved ones?
When we talk about COVID, it's a new technology, and it's mRNA. How are mRNA vaccines different than other vaccines we're more familiar with?
Yeah, I mean, it's a brilliant, elegant way to cue our immune system. So many vaccines up until recently have worked on either giving the patient the viral protein that tells the immune system to make antibodies, and they bring in the cavalry with your immune system so that when the virus is actually presented, you can launch an immune response. We also used inactivated form of the virus, but the mRNA technology, what it does, it injects basically a script. It's almost like a recipe for our cells to make the spike protein that's on COVID. And by generating this, our immune system says, what's this? What's this? We create an immune, I call it an immune army, and there's multiple types of cells that, heaven forbid, you get exposed to COVID, your immune system is ready to go. It's primed to fight.
And when we come back for boosters or a new COVID vaccine, as they're changing over time, are they specifically targeting those viruses?
We're trying. It's difficult. As I mentioned, things are shifting, so viruses are shape shifters, but we have a sense of what's happening, and we certainly try to match the most updated vaccines to what's circulating in the community. Nothing's forever, so speaking today, in 2 weeks we may find that there's other variants, but we do our best, and thus far the data has been quite promising.
Canadians are familiar with COVID now, but they might not understand just what some of the effects are of having that virus. Can you tell us about what one can expect if they are exposed to the virus? Well,
I would love a cheat sheet because I don't know any longer. I mean, it really is a maverick. I have, some patients that say I was just really tired and, I watched Netflix for 48 hours and I was good to go afterwards. And then I have other patients that say they were, unable to work, staying home for 2 weeks. And then tragically, patients who are at risk, older patients, patients with comorbid diagnoses, who end up in hospital, they are the ill of the ill. And once you are in the hospital, the tumbleweed starts and you start having cardiac events. There's other infections that happen. And one thing that I've started doing is obviously when we're providing education about vaccines, we're clearly trying to prevent the acute phase. Nobody wants to be sick, but I'm also vaccinating you so that you don't end up with long-term complications, and that if you end up in the hospital, chances are you won't leave the way you came in.
And for older adults, that functional decline really is something that has a knock-on effect through the rest of their lives.
The concept of wellness, of being able to live independently with dignity, is immensely impactful. That is the goal. And unfortunately, for patients who end up in the hospital with a severe vaccine-preventable disease, outcomes are dire. They usually leave either with comorbidities that are worse, or they leave not being able to return to their homes. They need supportive care. They become caregiving issues for their family. It's a scary picture.
So a very logical reason to be thinking about being proactive
Absolutely.
for your own health. Now, I remember I got the COVID vaccine early on, and then I got COVID. Does that mean that the vaccine didn't work for me, or what does it mean if you still get COVID after you've been vaccinated?
Okay, so nothing's 100% effective. There's also a time duration of protection. So, if you get the vaccine on month 0 and you develop COVID in month 10, well, your immune system lost their immunity and you needed an updated shot. The point is how bad was your COVID experience? And we can't really measure attenuated disease. I can tell you anecdotally, when a patient has had a COVID vaccine in general, it's not fun to have COVID, but the disease is in many cases mild. And you see this with other types of vaccines, shingles vaccine, influenza as well.
Now, I have aging parents in their 80s, and they're getting their vaccines where they reside. But if I get vaccinated, am I helping to protect them as well? Is there a reason that I should get the vaccine to help protect parents and those around me?
Yeah, so you can't make generalizations. Every vaccine has different data. In terms of COVID, we don't have transmission protection data. So, in that case, you're going to get vaccinated for a myriad of other reasons. But when you visit your parents, perhaps, if you're feeling unwell, throw on a mask, wash your hands, common sense things. Other vaccines, influenza, they do prevent transmission, right? So you can't make a one statement that covers all vaccine preventable diseases. But the point is we live in communities, and respiratory diseases spread ad nauseum during the throes of Canadian winter. So protecting ourselves, and in some cases, by vaccinating us, protecting our beloveds, it's timely.
So CARP represents an older cohort of Canadians. Are they more susceptible to these viruses, including influenza and COVID-19?
Absolutely. So the reality is in Canada, we have an aging patient population, which is a wonderful thing. I talk about our Canadians being an expensive vintage of wine. The problem with aging, and I don't have a solution to aging yet, we are trying, is that your immune system ages with you, right? So an immune system at 20 functions very differently than an immune system over 65. The other reality of aging is that you gather luggage, you gather diagnoses in the form of medical conditions, then you gather medications to treat your medical conditions that further challenge your immune system. So you can imagine the cumulative effect, and certainly as we age, we often live differently. Many older Canadians are living in congregate living facilities, nursing homes, retirement homes, which again, increases their exposure. So I think it is a multitude of factors, not just an age-related issue, but what happens when we age, both internally and externally. Vaccines go through immense vetting. We have years of data. They are safe.
Welcome back. Today, CARP's Chief Operating Officer Anthony Quinn is speaking with immunization educator Dr. Palmay at CARP headquarters in Toronto. The vast majority of CARP members believe vaccines are safe and effective, but a small minority still have safety concerns. So we wanted to ask Dr. Palmay, how safe are vaccines?
What about the safety of the patients? How safe is a COVID-19 vaccine and all vaccinations in general? How safe are they for the patients receiving the vaccines?
Okay, so vaccines go through immense vetting, and I understand that the rollout was very quick during COVID. One of the advantages of mRNA vaccines is they can be produced just by nature of the technology very quickly versus some other technology for other types of vaccines. They are safe there's always the chance of an adverse reaction. If you take a Tylenol, there's a risk of having an adverse reaction. If you, put on cream to control, an insect bite, that has a chance of having adverse reaction. There have been no overwhelming, immense adverse reaction signals. These vaccines are being studied quite intensely, and now, we have years of data. They are safe. Expectations have to be set. So when you have a vaccine, expect that perhaps up to 72 hours, you won't feel well, you may have flu-like symptoms of fever. That's your immune system responding appropriately. Beyond 72 hours, seek medical help.
So it's your recommendation that everybody who can get a COVID vaccine should, but we hear a lot of hesitancy about people taking these vaccines.
Yeah.
What should we be talking to those people about?
Yes, well, everybody's tired, so vaccine hesitancy is multi-pronged. The public's tired about hearing about viruses and COVID. We paid our tolls, during the throes of COVID with lockdown, leave us alone type of thing. Medicine's tired. We're exhausted after multiple years of fighting, of working under very difficult public health measures. And it's hard in a busy clinic when you're trying to update everything else that fell by the wayside to continue to rally. But we must. So, while we may be done with COVID, COVID's certainly not done with us. And I'm going to loop back to the discussion and the statement, being proactive is now the way to change the way we manage our health. And I certainly think, thinking back to the throes of COVID and lockdown and not being able to celebrate with your family, not being able to travel, time and the ability to do things that promote wellness, is a gift, and protecting yourself accordingly is appropriate. And
around this time of year, people are planning already to go and get their influenza shot. Can they get both at the same time?
Absolutely. So I'm very efficient, and certainly if some patients are trepidatious, you can come back if that makes you feel better. But nobody wants to spend time in a physician's office during cough and cold season. You'll leave with something that you didn't come in with. So, trying to maximize visit is really important. And, we've been told by NACI, which is I call them our immunization godmother. They give us the rules of the game. That we can co-administer COVID vaccine with other seasonal vaccines, RSV, influenza, pneumococcal, and in some other cases, patients are due for other vaccines, tetanus updates, et cetera. Verbatim, what I tell patients is, particularly with multiple vaccines, you may have, 72 hours of a little bit of flu-like symptoms. Certainly your arms may be sore depending on where I injected, but those are short-term side effects and are expected.
Is there anyone that shouldn't take the vaccine? Would a doctor not prescribe it for somebody? Is there a reason not to take the vaccine?
Well, the one reason you shouldn't get any vaccine is if you're allergic to a component of the vaccine. I've had maybe one patient in my practicing experience, and that was very specific. So in the case of COVID vaccines, if you've had a severe reaction, the list is quite immense, we still recommend that you consider being vaccinated, but perhaps under controlled circumstances. So you're either getting the vaccine at a hospital, you have an allergist consult. So the short answer is, there's very few people that have an official contraindication to a COVID vaccine.
So someone who may have had an organ transplant, or are those people, will they benefit more from a? Well,
they're top of the list, so they're considered to be the highest of high risk. So absolutely, other high risk patients, patients who are pregnant, patients who live in congregate living facilities. You mentioned transplant patients, patients on chemotherapy, and then patients with severe comorbidities. And you can think about diabetes, COPD, asthma, people who need medications, have psoriasis and are on medications that compromise their immune system. So, you almost think, do we give the frail of the frail this vaccine because we're worried? You absolutely do, because we're worried about them.
So, Dr. Christine, what is your best pitch to our audience on why they should get vaccinated this season?
I think the main concept is wellness. What does wellness mean to you? And I would assume wellness means living independently, being able to enjoy activities, being able to spend time with your family, being able to be physically active. The list can go on. And for anybody who has a severe vaccine-preventable disease, that may not be possible. And preventative care, there's not many things we can do to make guarantees. But I think immunizations, making sure your immunizations are updated, whether it's the updated COVID vaccine, whether your tetanus is updated, whether it's herpes zoster, shingles vaccine. You know, that gives you an insurance policy and increases the odds that you will be able to go away on your cruise that you planned 2 years ago. You'll be able to sit around a table, be able to play with your grandchildren. So instead of looking back, nobody wants to look back to COVID. We're not going there anyway. Look ahead and choose to be proactive.
Well, thank you, Dr. Christine, for coming here today and sharing all of your expertise with us and our audience. Thanks again.
Very grateful to be here.
The data is clear. Vaccines are safe and effective. According to our recent survey, CARP members want them, and they want them made in Canada. In fact, 79% believe the government should prioritize Canadian-made vaccines. They could soon get their wish. New vaccine production facilities are coming online, including one in Laval, Quebec, that will be able to produce 100 million doses of mRNA vaccines annually. Wherever they come from, I'm a proponent for immunization. I've had all my shots and I intend to keep getting them. CARP too believes all older Canadians should have equitable access to the most effective vaccines available. That's why we promote vaccine information, accessibility, and affordability. Access to vaccines differs by province across Canada. So we at CARP urge all seniors to talk to their elected representatives to express their desire for complete coverage of all 5 key vaccines. After all, prevention is the best medicine. And that's the show. And remember, as our CARP chairman Moses Neimer always says, the best way to keep going is to keep going. So Carpe Diem and seize your day.